The reason that we're seeing this movement towards medical practice consolidation has to do with the fact that medical practices are being squeezed in many directions. Their reimbursements are being cut, their costs are going up, and it's a very highly regulated industry with a lot of potential pitfalls that medical practices face. One of the great questions as we go forward in the industry is, will the hospitals succeed this time and will they stay together? Or will these fall apart again, either based on the hospitals not being able to manage the practice, or the doctors who are typically signing 3-year employment contracts not feeling they are being compensated properly at the end of that time frame. When practices have the opportunity to consolidate, they have to consider how it's going to economically impact them. They have to take a look at where their revenue streams are coming from. They have to be aware of their RVUs, their relative value units. These are items which are utilized when they negotiate with the hospital to make sure that they're getting their compensation. And they want to have their compensation based on a RVU type of methodology, which will make sure that if they're putting in the same effort they've been putting in now, they're not going to be subject to the vagaries of the marketplace that they had in their own private practice. When you see the consolidations that are now occurring, they really flow into a few different models. The first basic model is the hospital model, where the doctors become employees of the hospitals, and there are really two variations of that. The initial variation, which we saw, is the doctor goes to work for the hospital, they take over his entire practice, and he gives them the keys. The second variation, which we're beginning to see more of now, is the doctor goes to work for the hospital, but his medical practice continues as a management services organization, which he still owns and runs, even though the hospital is the one who's really calling many of the shots. There are also alternatives which do not involve joining the hospitals, and those are the so-called mega practices, and we're seeing those in two variations. There's the multi-specialty practice where many disciplines come under one roof, and there's also very large single specialty practices which just address one type of medicine. Working with doctors with their RVUs is an important area where we could help to guide them, because it really has become the bedrock of medical reimbursement. And that's something where, by doing it properly, you could have an employment contract where down the road they are protected, as opposed to just coming up with a random number which looks good today, but then might be changed 2-3 years down the road by the hospital or by the healthcare system. If you're faced with these decisions and this process, there are many considerations that you have. We're here to help advise you on these matters.